Coding burns. Okay, so the subject actually is burns and corrosion. This is what the topic for tonight is, and also we're going to cover the drug related injuries which will follow after this burns and corrosions. Okay, so does everybody know the difference between burn and corrosion? Does anyone know what is burn and what is corrosion? Is there a difference? Well, coding guidelines say there is a difference. Well, what I understand about burn is something that the kind of injury when a patient gets in contact with fire or hot surface, like, if you accidentally got in contact to the hot stove, right, or oven. So that's and you suffered blister, and that's burn. Okay, so it's a thermal heat type of injury. That's what burn is. Now, when you talk about corrosion, this is a type of injury a patient or a person sustains when a person got in contact with a chemical. Okay, anything chemical related type of injury is, I mean, like, on the skin, not chemical being ingested. But if you got in contact with, say, for example, a nitric acid and you hurt your skin, that is corrosion. So that's the difference between these two types of injuries. Now, in terms of coding, guys, let's go to the ICD-10 description. Let's read this. The ICD-10-CM makes a distinction between burns and corrosions. The burn codes are for thermal burns, except sunburns, of course, that come from a heat source such as fire or hot appliance. The burn codes are also for burns resulting from electricity and radiation. So there you go. However, corrosions, on the other hand, are burns due to chemicals. The guidelines are the same for burns and corrosion. So there's not much of a difference, or there's no difference at all in terms of code application, okay? When we talk about the guidelines, but there's a difference between the type of injury. Okay, let's talk about how to code burns. Let's read. Burns are classified by depth as first degree erythema, second degree blistering, and third degree full thickness involvement. Burns of the eye and internal organs, which this is the code range here, T26 to T28, are classified by site, but not by degree. Okay, so let's talk about the first one here. Burns are classified as to the depth of the first, as the depth, okay? Meaning the severity of burn is classified or identified how deep how deep in the layer of the skin is affected by that injury. So there is what we call first degree, second degree, and third degree. First degree is described as the erythema. Erythema, guys, is basically just the reddening of skin. When you get in contact with a hot appliance or hot surface and the skin did not break, it just it just reddened. So that's what we call erythema, and that's a first degree burn. Now, a second degree burn is when there is what we call blistering. So I'm pretty sure you guys have experienced burns that resulted in blistering. I have still marks of the blisterings on my, you see that right here? These are blisters when I got burned from a hot cooking oil. So I was cooking sometime. I was, out there. We had like, I think that was the 4th of July. There was a party, and I accidentally, the hot oil spilled over my arm, and it got burned. So I sustained a blistering of the skin, and that is what the guidelines are saying. That is the second degree burn. Okay. Now, if the burn affects a full thickness of the skin. Full thickness means the whole layer of the skin, including the subcutaneous layer, that's what we call a third-degree burn. Okay, so when you're assigning a code for these different types of severity, guys, look at the chart, whether it is first degree, second degree, or third degree, because there are specific codes as to the degree or as to the severity of the injury. Okay, so that is what burn is. So that's the first one. Second one, okay? Sequence first, says here, sequence first, the code that reflects the highest degree of burn when more than one burn is present. So it is very clear, guys. Talk about organizing your codes. The guideline said you have to sequence as primary diagnosis the injury of its highest degree, the burn that has the highest degree. Let's say, for instance, a patient suffered degree of both arms, okay? One arm is second degree and the other one is first degree. And also the patient also suffered burn in the leg, which is more likely an erythema. So the guideline said you assign the highest degree as your primary diagnosis, as you have to sequence that first. Okay, so the third degree comes first, second degree, and then third degree. So it is very clear, guys. Sequence first, the highest degree. What else? So it says here, when a patient has both internal and external burns, the circumstances of admission govern the selection of the principal diagnosis or first listed diagnosis. So what does that mean, guys? So if the patient, I have not seen a case like this yet, because usually when you work in a trauma hospital, especially in the burn unit, this is where you're going to see all these types of cases. But I haven't seen it because yeah, I mean, like, I have not really encountered such case yet. Both the external and the internal part organs are affected by burn. So that is so severe, right? Now, the guidelines said if both external and internal organs are affected, then you have to weigh things, whether which one is more acute. Is it the internal or is it the external? Now, the most acute injury would be sequenced as your primary diagnosis. Okay, any questions so far? It's very straightforward, guys, right? So when you look for the code for burn, guys, it's pretty much straight coding. You go to the term burn and then look for which body part it is, okay, which part of the torso or the arm, and look for the severity, whether this is, if the documentation says this is second degree burn, you will be able to see that in the book. There is a specific code for each severity. Now, look, let's read this. Burns of same anatomic site. Classify burns of the same anatomic site and on the same side, but of different degrees, to the subcategory identifying the highest degree recorded in the diagnosis. Okay, so what does this mean, guys? This means if patient suffers multiple burns in the same anatomical site, let's say, for example, the front torso, okay, anterior torso. If the patient suffers like third degree on the upper torso, like in the thorax region, and also second degree on the abdomen, third degree on close to the thigh, first degree close to the thigh, the guideline said you only assign the highest degree as your as the only code. So that's what it means, guys. Classify it according to the degree of the burn. So if it's the same anatomical site, one side is, second degree and one side is first degree, you always default to the highest degree, and that's the only code you are to assign. Is that clear, guys? Any question, any comment? Okay, let's continue. Non-healing burns are coded as acute burns. There are those types of burns that are really stubborn, guys. They don't heal fast, or they don't heal. They kind of like stay there chronically, but says here non-healing burns are coded as acute burns. So you have to assign that code for acute burns. What about codes for burns of multiple sites? Let's read this. Codes for burns of multiple sites should only be assigned when the medical record documentation does not specify the individual site. So apparently, guys, there is a designated code for multiple sites of burns. Okay. Now, the guidelines are giving us a warning, though, that you only assign that code for multiple sites, guys, if there is nothing specified in the medical record for individual site. Okay. If the doctor said patient has burn all over, and there's no specific a specific part of the body that is identified as the one that suffered burns, then you can code that multiple site code, or you can assign that multiple site code, because there was no specific or detailed identification of the site. Okay. Any question, guys, so far? Any question or comment? See here. Just unmute yourself, guys, if you have a comment or follow-up question. Let's get to the next one. Okay, what is this rule of 9 for burns and corrosion? Let's read this. Assign codes from category T31, burns classified according to extent of body surface involved, or T32, corrosions classified according to extent of body surface involved. It is also advisable to use category T31 as an additional code for reporting purposes when there is no mention of a third degree. Let me just fix this. Third degree burn involving 20% or more of the body surface. Okay. And continues here, categories T31, T32 are based on the classic rule of 9s. In estimating body surface involved, head and neck are assigned 9%, each arm 9%, each leg 18%, the anterior trunk 18%, posterior trunk 18%, and genitalia 1%. So that's basically what rule of 9 is, guys. Okay, so rule of 9, this is a language or a medical jargon in the trauma unit, in the burn unit. So when you talk about rule of 9, it refers to, or it pertains to a estimation of the affected body surface. That's what rule of 9 is. Say for example, patient came in with the whole arm is one arm, the right arm is burned. Okay, so the rule of 9 says one arm is equivalent to 9%. So I guess this is how the multi-disciplines in the burn unit communicate with each other. Like, hey, this patient has like 27% of affected body surface. So that's what rule of 9 is. So you just want to remember that there is a specific percentage that is assigned to each part of the body. Like, both arms, okay? One arm is 9%, another arm is 9%, one leg is 18%, other leg is 18%. So that's what rule of 9 is all about, okay? I guess this is the language they use in order to communicate faster, and everybody is pretty much in one page. Okay? Any question, guys, on the rule of 9? So this is the reason why it is necessary to be able to identify, what are those body parts that were affected, at the same time, how much of that body parts were affected, because each I think anything that's 20% higher, the guidelines saying here, let me go back here. This rule of 9, okay, there is mention of a third-degree burn involving 20% or more of the body surface. So if the body surface that is affected is more than 20%, there is actually a specific code to use for that. Okay, let's read again. Categories T31 and T32 are based on the classic rule of nines. In estimating body surface involved, head and neck are assigned 9%, each arm 9%, each leg 80%, the anterior trunk 18%. So again, guys, this T31, T32 are used using the rule of nine principle. Okay. Any question, guys? So rule of nine is basically just an additional like tool or guideline or guidance to the coders and also to the clinicians how they are going to document that type of scenario.